The U.S. Senate recently passed a bill to expand state and local programs to fight the nation's opioid drug epidemic. As the country grapples with drug addiction, hospitals are seeing evidence that it's affecting the next generation. Every 19 minutes, a baby is born in America to a mother who struggles with opiate addiction, a number that has skyrocketed in the past decade. When a developing infant is exposed to opioids in the womb, it's called Neonatal Abstinence syndrome. Here to talk about NAS is Dr. Diana Ramos. She co-chairs the National Preconception Health and Healthcare Council. Dr. Ramos, what's been your experience with NAS, and have you seen more babies born addicted to opiates?
You know, Danielle, we're starting to become more aware of the issue, as you mentioned, the headlines. But we're not seeing, at least on the West Coast where I'm practicing, as high of a rate as there is more on the East, Midwest area. But it is definitely an issue that we are now more aware of this. And we're all in the American College of OBGYN getting more training and becoming more alert and making sure that our patients have that preconception health education and planning if they are on opioid medication.
Now, is there a certain type of pregnant woman that doctors are seeing that's giving birth to these addicted babies? Perhaps a certain race, social class, anything like that?
You know, I wish I could tell you that, yes, there is a formula, there's a typical patient that we look for, but that's the scary part about opioid addiction, is that it impacts everyone, low socioeconomic, higher socioeconomic, white, African American, Hispanic. From the data, we know that there's a slightly higher increase of opioid use among white women, more so than African American and Hispanic. This is nationally, but there really isn't any specific formula or any stereotype that we can say, here's this patient, let's be more alert. It's something that we have to be alert with every patient that we see.
So, and I think a lot of people might find that surprising. You're seeing it more in white women. I think a lot of people were expecting you to say something else. Tell me a little bit about that. Is it a certain type of drug that you're seeing?
Well, oftentimes the typical medications that are associated are pain medication, opioid medications. Anytime a medication is taken continuously, it could also include among the opioid medications, it can also include some depression medication that we're now also seeing because the babies withdraw. So it's any kind of abstinence, any kind of withdrawal from a drug that the mom has been taking when she's been pregnant. So it could be pain medication, it could be depression medication, mental health medication, and that's why it's important to have that conversation with a healthcare provider before a woman becomes pregnant, because if she is on a medication that could potentially be addictive for the baby, perhaps before she becomes pregnant, she can be transitioned to a different medication that may not be as addictive for the baby.
Has there been any talk about medical marijuana? I know a lot of studies suggest that medical marijuana is non-addictive. It could be a good alternative to opioids. Is that something that's being explored?
Well, medical marijuana is becoming more of an issue throughout our country as it's becoming more legal for medicinal uses in several states. And I think as time goes on, we're starting to get a lot more information. We really don't know enough information in terms of specifically right now with addiction, but we do know that there are negative effects in terms of higher risk for prematurity for babies when they have been exposed to medical marijuana. So again, you really have to have that conversation with your healthcare provider to see if that's the best medication. And at this point, a lot of more of analysis and research is being done to truly understand the impacts not only on the mom, but on the baby as well.
Now, completing the withdrawal process, I expect could take maybe months. Are health insurance plans covering these babies and their mother's stay in these cases?
Yeah, so when the baby is born, really it's the baby that's the one that's suffering the most from the withdrawal because the baby no longer is inside the womb and getting the medication that perhaps the mom was getting. So it can vary depending upon the medication the baby was on, anywhere from days to months in terms of withdrawal. And some of these babies are very jittery, they cry a lot, and they also may have seizures. So it could actually increase their hospitalization stay stay. And data shows that it can, the babies are in the NICU longer, and the NICU, is very costly. And so, yes, insurance companies are paying for the care of these babies. And oftentimes the biggest payer is Medicaid. So it is us, all the federal government, all of our tax money that is going to pay for the care of these babies.
NAS has forced some state lawmakers to decide whether the mother's drug use is a criminal justice issue or a disease. Where do you think that most physicians and nurses stand on this issue?
Well, there actually was a recent federal law that was passed that tried to address the fact that up until recently, every state had different recommendations as to what should be done for moms who had a baby who that was addicted. And it's trying to be less punitive, and it really is trying to help the mom and, more importantly, the baby. So really the programs that are in existence, the laws that are in existence, are trying to help identify the moms that may have a baby that's has a neonatal abstinence syndrome, and help her take care of that child, and help her get help for herself depending upon the medication, so that she can be a better mom. So all of this goes back to the preconception health, interconception health, so preparing for that next pregnancy and helping be a better mom so she can really take care of her baby.
So ultimately, perhaps choosing health care over handcuffs.
That's correct. Yes, that's the ideal.
So where do we go from here? How do we get these babies being born healthy and not addicted?
I think part of it is multi-pronged. One, for us, the healthcare providers, we're now becoming more aware of the medications that we're providing to our patients. I think it behooves us, especially if it's a reproductive age woman, to make sure that she plans that pregnancy. Again, we don't want to be providing a medication that could be highly addictive to her baby. And I think also as a population, as a public, is really being aware if I'm taking a high risk or highly addictive medication and I don't want to become pregnant, maybe I should be using a contraceptive that's going to be highly effective so that I don't have to be faced with choices that I may not be ready for, and having to take care of the baby that perhaps could be born, addictive. So we know that addiction can really affect the baby initially, but then oftentimes there's lifelong consequences, developmental consequences. So I think all of us preparing as a country, becoming more educated and taking initiatives to take care of our reproductive planning is really going to help make a difference.
Such a sad topic with so many innocent victims. Dr. Diana Ramos, thank you so much for joining us tonight.
Thank you so much.